So we will start over with the infection control topics. The first chapter, page number 5 onwards, the introduction. Okay. If anyone is joining late, please help them out with the topic name. Just a brief about the course and the topics that we'll be covering in the next few months. In August, you will have your exams, August, September. That is the time, most probably, the exams will be conducted for the students who have joined before April and all. You can confirm your exam dates with Dr. Mittal sir as well. So by then we will do the revision. Okay. And the students who have joined newly, this will be your new session as well. Okay. For previous batch students, this is kind of considered this as a revision session. So hospital infection control, policies and program. So healthcare associated infection is one of the most common complications of healthcare. And if you don't manage it properly, it could lead to increased patient morbidity. Disease rate is high. Patient mortality will also go up. Okay, death rate and increased patients' length of stay, increased patients' cost of hospital stay, length of stay. You will be blocking that bed for new patients, so you will not be able to make profit as hospital. You will not be able to make more profit. Okay, if the patient length of stay increases, increased patients' cost of hospital stay. Okay. So these things will happen because of healthcare associated infection. Okay. So infection control and prevention policies, usually it will provide a high quality healthcare for patients and also for people who are working in hospitals to make a safe working environment for them. That is also the goal of infection control policies. Okay. Anyone who is coming in the premises of a hospital should be safe, should not be at the risk of getting an infection. So this course outlines the broad principles and practices of infection control that are essential for prevention and management of infection in hospitals. That is what you will learn throughout the textbook. Okay. So majorly, these are the main areas you have to focus as an infection control nurse or officer. Okay. What are the basic guidelines of preventing and controlling infections? Antimicrobial policy, antibiotic stewardship, surveillance policies, disinfection, okay, sterilization, disinfection, cleaning policies, isolation policy, outbreak. When an outbreak happens, what is the policy of investigation? Okay, these all things will come under, usually it will come under the infection control policies. Okay. And then we'll have a committee as well. There is a hospital infection control committee. So their role is to implement annual infection control program and policies. That is the main role of the hospital infection control committee based on the policies that come out from WHO, okay, World Health Organization, CDC, Center for Disease Control. Okay, usually they will, and also at government level, at national level, also policies are made by individual healthcare ministries of each and every country. They have their healthcare ministries. They will also make policies which the hospitals have to abide by. Okay, so based on these external factors, internal policies are made. Okay, maintain surveillance over healthcare associated infection. There are total 4 healthcare associated infections. So how many cases you have on a monthly basis? Which department, which ward or department is getting the highest number of cases? Which type of hospital acquired infection is on rise? Okay, as compared to the previous year's data or previous month's data, how are you performing right now? Okay. So these areas you have to clearly document when it comes to surveillance. Okay. Surveillance is keeping an eye out for. What does a CCTV camera do? Okay, 24/7 it keeps an eye out for, it observes, it watches. Okay, and that is how the healthcare workers, the infection control officers, have to do the surveillance specifically for healthcare associated infection. Keep an eye out for any signs and symptoms that could lead to infection. Okay. And when it comes to healthcare associated infections, you have to identify, report, analyze, investigate, control. Okay, identify, first find out what type, what are the signs and symptoms. Okay, signs and symptoms are the first telltale signs that something is wrong. Okay, so have an eye out to correctly and on time identification has to be done. Okay, report it to the officials. They will come and do the blood sampling, swab. These things will be collected and analysis will be done in the laboratory. Okay. And once the reports will come, you will get an idea what kind of infection was it. Okay. Based on the report, what actually went wrong. And based on that, investigation has to be done. Why did this patient get this particular healthcare associated infection? What went wrong? What was the discrepancies which were there in the care? Okay, what was the inherent factors that the patient already had which could put them at a risk of infection. Okay, so this investigation has to be done. Once you find answers to these questions in your investigation, you would know better how to control. Okay, so that is how you take care of hospital acquired healthcare associated infections. Develop and implement preventive and corrective programs for infection hazards. Advise management on antibiotic policies, antibiotic stewardship. Okay, whatever new data is coming out from the antibiotic research and stewardship research, okay, that has to be implemented. Okay, trial and error has to be done in the hospitals. Review and update healthcare associated hospital infection policies and procedures from time to time. Annually, usually it is done. Okay, annually what WHO or CDC is saying, or any changes that they have made to the basic structure of the infection control, if that has been done, it has to reflect in your infection control manual as well. Health education for employees is mandatory. Okay, frequent training, regular training should is also mandatory. This is the hospital infection control committee, the way how it is organized. Okay, at top you have the chairperson or the head of the institute. Under them is the member secretary. Usually they are the senior microbiologist, okay, of the hospital. Under the member secretary, you have representative members from each and every department of the hospital. The non-medical departments, okay, like HR, IT, insurance, public relations, okay. The representative members from these departments should also be the part of this committee, okay. Then you have the head of the department or relevant members, medical faculties, okay. Representative members from management is the non-medical faculty in a hospital. Okay, then you have members from the medical faculty. Okay, so cardiology, ophthalmology, orthopedist, okay, microbiology, all the specialties you have in a hospital. Okay, a representative from these medical faculties should be a member, one representative at least each. Okay, then you have the infection control officers, infection control nurses. Then under them, you have the support services of technicians, OT technicians, CSST technician, housekeeping staffs, pharmacy technicians, and all. They come under the support services. So these are the main members of a hospital infection control committee. Okay, this is the structure of the organization. The core team, infection control core team, microbiologist will lead the team. Under the microbiologist direction, infection control officer and infection control nurse will be there. Okay. Officers will usually work on the data control, data analysis, data collection, okay, reporting, charting the data. They work on that and also observing, following the checklist and all. Infection control nurse is usually practice based. Okay, they are in touch with the patient. They are a bridge between the infection control officer and the patient. Okay, so these are the main jobs that the core team does, infection control team does. Okay. Then you have education and training of healthcare staff by IT infection control team. So the team is responsible for making sure that on a regular basis, continuous health education is given. Okay. Even if it is repeated topics, does not matter, but continuous healthcare education and training is given to the healthcare staff. Okay. That is the main responsibility of the infection control team. So first you have to assess as a team, either the officer or the infection control nurse will assess what is the requirement of the training. Okay, and which areas nurses or the healthcare practitioners don't know much about. Okay, so that is your training need. Then you conduct the training through awareness programs, in service education, on job training. Okay, through these areas you will conduct the training. These are the many different options you have to give to spread awareness. Okay, in service education is people who are working, their hospitals may sponsor the courses for them, like infection control course like this. Okay, some hospitals will sponsor that for their staff. So that is in service education. On job training is that you are being hired by a hospital and the hospital will train you on infection control practices, what you have to do, do's and don'ts, rules and regulations. Okay, that is on job training. Okay, in service education you get a certificate for what education you have done it, if it is a diploma level certificate or etc. Okay, postgraduate diploma level, whatever. Okay, organize regular training programs as per job descriptions of the staff. Okay, the training that a doctor may receive is slightly different from what nurses undergo, the physiotherapists undergo. Okay, so based on the caliber, the skill, the job profile of the staff, different type of training programs are made for them. Okay, provide periodic retraining or orientation for the staff as well. Like even as I mentioned, even if you have done the even if you have done the training, if you have undergone a training session, or if you have given a training on certain topic, okay, it can be repeated. The same staff can re-attend the same topic, okay, to clarify any doubts or if the first training was not enough. Okay, so periodic retraining is required. Then after this training and education that everything is given, you have to see the impact of it. Okay, was it worth the hours and energy that you have spent? Is it reflecting on their knowledge? That is reviewing the impact of training. Okay, whatever you have taught, is it being understood by them? Do they comprehend what is infection control policies and practices? Okay. Next, you have surveillance of healthcare associated infection. So surveillance means, as I mentioned, it is a continuous collection of data. Okay, collection of who was not well, what was the temperature change, okay, what was the redness and all, infection rate. These data you will collect. Analysis, you will study a pattern. Okay, interpretation, you will understand the pattern. Okay, so when you do analysis, lab reports will also come into action. Okay, interpretation is you are making a conclusion. Okay, this patient is inching towards ventilator associated pneumonia. This patient is, we think they are into, they have got COTI. Okay, catheter associated urinary tract infection, like that. Okay, so that will be your interpretation. And once you have that data, you disseminate it. Okay, you inform it to the doctors or nurse, whoever. Okay, that this person, we through this data we see that this person is affected. Okay, this is an individual case, but when you do this for 50 to 100 patients, okay, that becomes a data collection, it becomes a minor study, and it will be represented in the committee meetings and all. Okay, coming to the objectives of surveillance related to healthcare associated infections: continuous monitoring of incidence of infection rates has to be done. Each and every incidence means new diagnosis. Okay, that is incidence. So continuous monitoring of new incident rate, that has to be reported, documented. Continuous monitoring of trends, detection of hospital outbreaks. What was the situation last week? What was the situation last month? What was the situation last year? Okay, in the past 6 months, is the infection rate going down, or is it going up, or is it this at the same level? That is, you are monitoring the trend, what is happening. Okay, as compared to, there's a time comparison. Okay, then detection of hospital outbreak, two or more cases which with similar signs and symptoms. When they're getting admitted, you suspect there is an outbreak. Okay, then providing early warning and investigation of infection problems, which happens if the surveillance system is very strong. Okay, initially you are not waiting, as soon as possible you have done the surveillance, you didn't waste time there. Planning and intervention to control. Okay, if there is an outbreak, how do you control it? In detail, we will discuss that in the coming up chapters. Okay, there is a chapter on outbreak control, hospital outbreak. Prioritizing resource allocation. When budgeting is done, yearly budgeting is done in the hospital. Okay, priorities are set. Which department will get what amount? Okay, so usually the high risk areas are the ones where the hospital usually invests more. Examining the impact of intervention, whatever changes you have done in the infection control policies, in your method of approach. Okay, whatever new methods you have used to reduce the healthcare issues, infection control issues. Okay, are they working? Okay, is it giving any good benefit to your hospital? Is it increasing the quality of care of your service sector? Okay, these things you have to check. You can't just blindly make up the rules and keep following it. You have to look back and see, is it working or not? Are your policies and guidelines working or not? And gaining information on overall quality of patient care. Okay, that from if you can do a questionnaire for the patient or customer satisfaction survey, okay, visitor surveys. If you take these things on a regular basis, you will understand where you are lacking, where you have to improve. Coming to components of surveillance system, you have a case definition. Case definition is not every case becomes an outbreak. Okay, there is a specific definition to each and every case. Okay, each case must have a standardized and consistent signs and symptoms. Only then you can define it as a tuberculosis or measles, mumps, rubella, whatever is the situation. Okay, there are specific signs and symptoms. There are specific organisms that may have caused that infection. Based on that, you will define a case. You will give a name to that disease. Okay, that is case definition. Active surveillance of healthcare associated infection is done in high risk areas. So the high risk areas are your ICUs, all your ICUs, NICU, PICU, CICU, SICU, MICU. Okay. Your surgical and respiratory units, isolation units, OT, operation theaters, dialysis unit, burns unit, transfusion service, blood bank. Okay. Food handling service, dietary department, drinking water areas, all the drinking water areas, CSST. These are the high risk areas of a hospital. Okay. Then OTs, operation theaters, routine fogging is not recommended usually, but when a OT has took a septic case or an infected case, it's generally said that after the case is done, fogging can be done or fumigation can be done. Fogging of the OTs can be done on the basis of reports or clinical procedures that was carried out. Okay, if a septic case was operated in the OT, definitely soon after that operation is done, fogging has to be done. Okay, if an infected case or a TB case was been operated on in an OT, that particular OT has to undergo fogging or fumigation after the patient has been discharged from the OT. Okay, like that. So depending on the case, what case the OT has seen, fumigation and fogging is done accordingly. ICUs as well on a regular basis. You have to monitor what kind of infections are rising in ICU. Okay, especially in ICU, a lot of invasive instruments are put on the patient. Okay, like ventilator, catheter, central line. Okay, these things are post-surgery patients are also there. Okay, so what kind of infection is on the rise? Usually it is COTI, catheter-associated urinary tract infection is the one that is very common. Okay. So what you can do is to check the signs and symptoms, catch it as early as possible, give medication. Okay. So that's about the initial briefing.